It's 10 days, and in many parts of this country, especially Delhi, people are gasping for breath. If you're looking for verified leads, databases, and portals on oxygen beds, cylinders, ventilators, COVID related drugs, citizen led efforts, guides, and resources are still one of the best ways to get anything. I'm Anubha Bhonsle, and here on Newsworthy, the only question we're attempting to answer in this video is, where do things stand, and when are they likely to get better from just this one perspective? Oxygen. Lack of oxygen is a source of desperation and unimaginable grief for families looking to prolong their loved one's life, even if for just an hour. And it's a source of deep anxiety and fear for others who want to keep an oxygen cylinder or procure one for a future need. So, here's how things stand. Steps have been taken in the last 5 to 6 days to augment our oxygen supply. They are much too late, at least 5 months late. The warnings from the center's COVID response team for oxygen shortage came in November of last year. So all the steps that have been taken will need time to make substantial difference on the ground. It is safe to say nothing will change tomorrow, nothing will change day after, perhaps in a week. No expert is saying it with any certainty. Oxygen for industrial use has been diverted to hospitals. This order came on the 22nd of April, so it will take a little more time to have an impact. Number 2, many countries are sending oxygen concentrators, mobile units from their own stockpiles. They have to be deployed. There are no details of how, when, and where the center will be allocating these to. 3, defense facilities have been converted into dedicated COVID hospitals. This has started. 4, private firms like Tata, Reliance, JSW Steel have repurposed their factories to produce and supply medical oxygen to states that are facing shortage. Some, like Vedanta, have been given permission to temporarily reopen to make oxygen. 5, a global tender for importing oxygen has been floated. We can't say when it will fructify. Number 6, 100 new hospitals with their own oxygen plants have been announced, and I know it feels like a cruel joke. For tenders that were floated by the center in last October, 462 oxygen plants in district hospitals, just 33 have been installed. A scroll report shows the same old story: vendors ran away, no land permissions, electricity connections missing, etc. So net, by end of May, 80 of the 162 plants will be in working condition according to the center. So those 100 new hospitals with their oxygen plants, no one is holding their breath for that one. This was all about the center. What are the states doing or have done to augment capacities when we had a breather between the two COVID-19 waves? One PSA oxygen plant costs about 1.25 crores and can sustain at least 100 people on life support. Delhi, that's possibly the worst hit city in the world currently, has zero oxygen production capacity of its own. The government claimed it can't set up PSA plants because of air pollution norms, a logic that has no real legal basis. Madhya Pradesh placed purchase orders for 13 PSA oxygen plants on 14th April, and the visuals came too close home. The problem, as some of you may know, is not oxygen production but oxygen distribution. We may have the oxygen stocks we need, but we don't have, and we didn't make plans, strategies, and contingencies on how to transport oxygen from plants that manufacture it to hospitals and private vendors that supply it. The distribution network is stretched and uneven between many states, and the specialized tankers that we need are very few. Delhi's condition is at breaking point, and the national capital does get some media attention. I'm not going to spend any time referring to the frustrating politics between the center and the state and the sheer apathy of both these institutions. In the last days, the unthinkable has happened many times over. Several hospitals, as you know, in Delhi, including big private ones that some say could have augmented their own capacities by themselves, have tweeted SOS countdowns about how much oxygen they have left, often down to minutes. At least 7 moved the Delhi High Court for urgent midnight hearings, begging for orders that will refill their oxygen tanks. Gangaram Hospital lost 25 of the sickest patients in 24 hours, allegedly due to an oxygen shortage. The Jaipur Golden Hospital lost 21 patients in one day due to oxygen shortage, and these demands have still remained unmet even after these tragedies. Some of the hospitals are still tweeting every other day. Delhi needs more than 700 metric tons of oxygen for its current caseload. Its allocation was increased by the centre to 480. Even that has not been fulfilled even on one day for the last week or so. Why? States are saying that the centre is allocating more oxygen to BJP-ruled states, leaving others in the lurch. In one of the Delhi High Court hearings, Inox, which is one of the largest oxygen production companies, asked why Delhi wasn't getting its share of allocated oxygen. The manufacturer said it received conflicting orders from the centre asking it to divert oxygen to another state. He wasn't willing to say which state, but when probed by the court, he said it's one of the larger states. Oxygen is coming to Delhi from 1,000 kilometers away, according to a court document. Given the highly inflammable nature of liquid oxygen, it needs to be transported in specialized tankers, which are not driven at night, usually to prevent accidents. For the same reason, they don't drive above 40 kilometers per hour. So it takes time, which no one has, and it requires advanced planning, which no one did. Shortage of these tankers to transport oxygen was not addressed by Delhi till about 3 weeks ago, according to a Reuters report. Now, with COVID-19 cases swamping some of our neighboring states like Haryana and Uttar Pradesh, oxygen facilities are overstretched and there is a scramble among states. Again, the centre has woken up late to this tussle and invoked the Disaster Management Act to ensure oxygen transport is seamless. On April 25th, which was the 5th day of the oxygen crisis, Delhi government appointed civil servants to coordinate with authorities about oxygen supply. Today is the 8th day and there is no sign of respite, and there is unlikely to be, we're afraid to say. The price of buying and renting oxygen concentrators has skyrocketed as a result, from expensive to beyond reach for the average Indian. There is, of course, a black market. Delhi, Uttar Pradesh, Haryana and Gujarat have less allocation of oxygen than their daily requirement this week. Karnataka, Rajasthan, Maharashtra are saying they're scraping the bottom of their oxygen barrels. It will be a while before things begin to ease. So if you can, tune out the centre blaming states for not managing the demand and hospitals. If you can, tune out states where the Chief Minister wants to invoke NSA against oxygen shortage notices, or other states that did nothing. If you can, perhaps tune out hospital SOSs and the sheer irony of powerful military planes bringing oxygen for gasping citizens. It will be a while before things will ease. And as the citizens of this country who are coming together to save every life, we can return empty cylinders, not store them if we don't need them. We can volunteer to help update lists, connect resources, and trust our medical staff as they do the tough task of triaging, that is, rationing out hospitalization or medical oxygen. And of course, we can take lots of good care and vaccinate. I'm Anubha Bhonsle, and I believe at this point in time, apart from that oxygen cylinder, we need clear, simple information that will not mollycoddle you, that will not be politically partisan, and that will be empathetic. At Newsworthy, my team is doing just that. I recently recovered from COVID-19, so I apologize for my absence. But if you think this has been helpful, please share this video and help us do more if you have the means to contribute. The link for that is in the bio and in the comment section.